back in February, Republican leaders, including Speaker of the House Paul Ryan and Health and Human Services Secretary Tom Price, they put out what's being referred to as a policy brief. The formal name is the Obamacare Repeal and Replace Policy Brief and Resources. You can see it down there if it's something you want to do an internet search for and look up a copy of it. I believe it's about a 20-page document. But I like to say it's more or less of a marketing or advertising piece as to why most of the Republican Party thinks Obamacare is failing and why they want to move forward with something different. And I just took a couple points or bullets out of that document to give you their perspective. And the first perspective is it's of their belief that insurance markets are collapsing. Some are saying certain market segments are starting what's being referred to as a death spiral, meaning we won't be, absent any change, we won't be too far out from not having certain market segments. So, some of the statistics that we found in this policy brief were that 1 out of 3 counties in the United States now only has one insurer offering individual health plan options on the insurance exchanges. So for any of you that have bought a plan on the exchange, that would be at the healthcare.gov website for the state of Illinois. And that really is counterintuitive to what the Affordable Care Act's primary, or one of their primary goals of the exchanges, were to increase competition and increase the number of choices. And in actuality, we've seen in many parts of the country the number of choices and the number of insurance companies offering coverage decline. Again, 1 out of 3 counties just having one insurer. In addition, as a part of the Affordable Care Act, there were 23 new insurance companies that were created. These are referred to as co-ops. These are companies that got low-interest federal loans to really create insurance plans for individuals and small businesses. In Illinois, we did have one co-op company that was created. That was Land of Lincoln Health. If any of you are familiar with them, they were actually shut down last year as a result of solvency problems. And we've seen that really across the country with most of these co-op programs, with 18 out of the 23 now failing. So according to this policy brief, one of the primary issues or primary concerns that Republicans have is that they really feel that they are on a rescue mission specifically to save the individual market, those who have to get coverage on their own. They don't have access to coverage through the government or through an employer. They're really on a rescue mission to create a more stable market for the individuals that need to get coverage in that way. They also cite the fact that premiums and deductibles are soaring. Initially after the Affordable Care Act was passed, President Obama had said that the average family would see their cost for health insurance go down by about $2,500. And the Republican policy brief here is saying, well, that's really not happening. What we're seeing is average premium increases for plans on the exchange have gone up by 25%. And that spread really varies. If you go across state lines over to Indiana, they saw much lower rate increases for 2017. Really, rate increases were flat. But if we go all the way out west in a state like Arizona, the average rate increase was closer to 120%. So really depends on where you're at in the country as to what sort of premium increases have been occurring year after year. This policy brief also cites that there is a new kind of uninsured that has largely been created by the Affordable Care Act, and that's those people that are buying plans that have not only high premiums, but also high deductibles and high out-of-pocket expenses, as well as smaller networks of doctors and hospitals. It's really limiting their access to care. It's discouraging them from going to the doctor or a hospital because, either A, they don't have access to the doctor or hospital they want to go to, or B, they're going to have to pay a substantial deductible in order to get the care they need. So they're citing this new kind of uninsured. We normally refer to that as underinsured, but they're citing the Affordable Care Act as a primary contributing factor to this new type of uninsured. And the policy brief also points out that rate increases and these raising deductibles and smaller network plans are not isolated to the individual market. It is expanding to the group marketplace as well, especially the smaller employer marketplace. In Illinois, that's generally those employer plans that cover fewer than 50 employees. In addition, there were several what we call pay-fors in the Affordable Care Act. One of the missions of the Affordable Care Act was to provide subsidies to low and middle income families to offset some of their premiums and some of their deductibles, as well as to expand the number of people who are eligible for Medicaid. And as some of these covered expansion efforts, there has to be a way to pay for those people that are gaining coverage as a result of some government assistance. And there's about 20 different direct and indirect taxes included as part of the Affordable Care Act. And one example would be pharmaceutical manufacturers are charged approximately, as an industry, $15 billion a year in taxes. And those costs, in essence, are passed down to individuals and employers who are providing coverage to their employees. They're either passed down in the form of higher premiums or higher out-of-pocket costs or some combination thereof. And this policy brief cites that the Affordable Care Act has already triggered about $1 trillion in taxes, and those taxes, again, are while we may not be paying them directly on our tax return, many of us are paying for that in the form of higher premiums or higher out-of-pocket expenses or some combination thereof. So, citing some more information from this policy brief, these are really the objectives that the Republican Party has or that they would like to accomplish in the form of repeal and replace. And these are, if we took a 10,000-foot view at the Affordable Care Act or at Obamacare, and what would those things really look like? And the first is really federal deregulation. Republicans really believe that there's so many mandates and so many requirements of the Affordable Care Act that it's decreasing competition and increasing cost of coverage. And they are strong believers that the federal government really needs to take a big step back with the rules and regulations and push more control back to the state. They believe that states know their residents, they know their small businesses, they know the people that reside there better than the federal government does. And maybe it should be left up to the state to decide, for example, what sort of benefits should be included in a health insurance plan and what maybe doesn't have to be included in the plan. So they want to push control back to the state level. They also have an objective of letting free markets drive healthcare innovation. And one example that's oftentimes cited is telemedicine. Telemedicine is not something that was created by by the Affordable Care Act or by any other state or federal regulation. It was created by some innovative people who decided that the cost of going to see a doctor, especially for simple things like the cold or a flu, can be rather expensive if you don't have a copay. It could be $100, $150, $200 just to see a doctor to get maybe a cheap prescription to cure a common illness. And some innovative folks decided that, hey, maybe we can have people just call a toll-free number or go online and have the ability to communicate with either a registered nurse or a licensed doctor or licensed practitioner and be issued a prescription without having to incur a significant cost for seeing a doctor for something minor like that. And so they believe things like that will start to be more of the norm if there's more deregulation and we let just the free market create solutions to some of the rising costs of healthcare. Also have an objective of interstate commerce for healthcare. And what really that boils down to in the insurance world is giving individuals and even small businesses and large businesses the ability to purchase health insurance from a different state. So, for example, you might be able, as somebody living or working in Illinois, you might be able to purchase a plan from, let's say, Blue Cross Blue Shield of Texas, if that made the most sense for you. So through deregulation and through allowing states to have more control, really another goal is access to more types of coverage. You know, in the individual and small group marketplaces today, all health plans have to cover 10 essential health benefits. And these are benefits that were mandated by the Affordable Care Act. Things like your plan has to cover pediatric care, or your plan has to cover or mental health care or maternity services. And they want to scale back on what is required or mandated at the federal level so that there can be more plan options available. In the past, prior to the Affordable Care Act, some of you, if you've ever purchased a plan on your own, may have been familiar with a plan that was offered by Blue Cross Blue Shield of Illinois called the Basic Blue Plan. The Basic Blue Plan was really purely a major medical catastrophic plan. It didn't cover your office visits. It didn't cover your prescription drugs. But if you got really sick or if you were in an accident, you had great coverage for hospitalizations, for surgeries, for outpatient care, for cancer and things like that. And it was a very popular plan primarily because it was very affordable in terms of premiums. You saw in the previous slide that according to that policy brief, there's been $1 trillion in taxes created by the Affordable Care Act. Really, Republicans want to get rid of most, if not all, of those taxes because, again, they indirectly affect people in the form of higher premiums or higher out-of-pocket costs. And while this may not be something that is a repeal objective, more of a replacement objective, is governments or Republicans are strong believers in health savings accounts. And these are accounts, if you're covered by a high deductible health plan, you can put money into that account. It's tax deductible. It can be invested even and grow interest, tax deferred, and it can be withdrawn to pay for medical expenses tax free. They really want to expand those health savings accounts, increase the contribution limits, increase the types of expenses that can be used through the account, and that is a big initiative that they have as well. So, after all this talk, there were several years while Obama was in office. I know Republicans tried to repeal the Affordable Care Act. I want to say it was 40 different times. They pushed legislation either through the House, Senate, or through both on 40 different occasions. And if it ever did get to President Obama's desk, it was vetoed. So they never did, under the Obama administration, get to the ability to repeal some or all parts of the affordable. But now, as of January of this year, Republicans now control the House, they control the Senate, and they also have a Republican president. So they do, it seems, have the pieces in place to start to move forward with a repeal and replace strategy. And what they did is, after a couple of months of conversations and closed-door meetings and Speaker of the House and Senate Majority Leader and the HHS Secretary and other key Republican leaders, they got together and they did finally come up with a bill that would repeal and replace much of the Affordable Care Act, not all of it. And that bill was referred to as the American Health Care Act, or AHCA. So if you see the letter H, that is the indicator that we're talking about the repeal bill. So we've got AHCA, and then we've got ACA. So just be careful as you see the acronyms on the slide to know which bill we're talking about, whether it's the Affordable Care Act, Obama's bill, or the American Health Care Act, which is the initial bill that was proposed to repeal and replace the Affordable Care Act. So what this bill did, it was about a 110-page bill. It was had some revisions. It was first leaked out to the public in the middle of February. It went through a couple revisions after that. But some of the things that this bill was attempting to do was eliminate the individual and the employer mandate, so get rid of the requirement that you must have health insurance or pay a penalty. Get rid of the requirement that larger employers, those with 50 or more employees, have to offer health insurance coverage that meets certain requirements or potentially pay penalties. It attempted to eliminate many of those Affordable Care Act taxes that were included in the bill. It was going to change the way tax credits were provided in the individual market. You know, today, if you access coverage through an exchange, you may be able to get help offsetting some of your premiums or your deductibles and out-of-pocket expenses, but it's based on how much income you make primarily. Through the American Health Care Act, they were going to base your eligibility for tax credits, assistance in paying your premiums and deductibles, primarily based on age rather than income. The American Health Care Act also sought to change Medicaid funding. They were looking to switch to more of a fixed per-person payment, possibly even adding extra funding to those states that imposed a work requirement for those that were able-bodied, so your eligibility for Medicaid would be contingent upon you having a job or seeking a job or participating in a job training class. And it also sought to expand not only health savings accounts but also flexible spending accounts. But if you take a look at the American Health Care Act, we talk about the individual mandate, that's a penalty. We talk about the taxes, that's of course a fee or a penalty that's paid by some organization or some individual. Talk about Medicaid funding and HSAs. The American Health Care Act is really looking at what I'll call the financials of the Affordable Care Act. So why does it focus on the financials here? We talked about things like, one of the Republicans' objectives is not to have a federally mandated requirement of all of these 10 essential health benefits. Why doesn't it repeal some of that stuff, or the requirement to cover children up to age 26, or the requirement that insurance companies have to issue coverage to somebody regardless of their medical history? And I need to take a step back and tell you why. That's because under this current Congress, while it is Republican-controlled, they are short a few seats in the Senate to do some of the things that they want. So as of at least a few days ago, the Republicans had 238 seats in the House. And in order to repeal and replace parts of the Affordable Care Act or all of the Affordable Care Act, Republicans need 218 votes. So it looks like they're good there, right? They have more than 20 there. And it was actually, there are a couple seats in the House that are open. And I believe if they were to pass legislation today, they would only need 216 votes, but that's just because there's some vacancies there. If the House, if all 435 seats are filled, they need 218 votes. But they're looking like they're in good shape there. They have more than 20, so it seems like they should be able to get that through the House. However, on the Senate side, they're a little bit short. The House just requires simple majorities to pass a bill. So you just need 218 out of the 435, the simple majority. Well, there's 100 Senate seats, and the Republicans just barely have the majority. They hold 52 out of the 100 seats. And according to Senate rules, they need 60 votes to repeal and replace all of the Affordable Care Act. So if they want to repeal and replace all of the Affordable Care Act, that means they got to get all of the Republicans, all 52 Republican senators on the same page, and then they got to get at least 8 Democrats or maybe independents over on their side to vote with them. So a little bit of an issue there. However, that being said, there are some special rules as it relates to budget items. And there's something referred to as budget reconciliation. And this allows the Senate to pass bills that are only budget related with a simple majority. So they can pass things without the 60 votes, but they have these things that they pass, these laws that they pass can only impact federal spending or federal revenues or some combination thereof. And they just need 51 Senate votes, and as the previous slide mentioned, they have 52. So if all Republicans are on the same page, they should be in good shape to issue things or pass bills through the House and then through the Senate. But those things have to be related to the budget, has to be related to spending, or has to be related to revenues or some combination thereof. So what that means here today is that a full repeal of the Affordable Care Act, or a repeal of certain ACA provisions, I like to call these provisions the insurance rules, would require some bipartisan support, and at this time, there is no bipartisan support. Democratic leaders have said if repeal is on the table, they're not willing to work with Republicans on sort of fixing any of the problems that exist today with health care and health insurance. If repeal's off the table, Democrats have said they're willing to divulge in conversations with Republicans, but until that time, Democrats appear to be taking a big step back and just letting Republicans try to figure out what should happen with repeal and replace. So back to the American Health Care Act. So this bill was supposed to be voted on March 23rd, 2017, which is coincidentally the 7-year anniversary of the Affordable Care Act becoming law. So they thought it would be just a monumental and significant milestone if they could pass a bill on the anniversary of the Affordable Care Act. And, there was a lot of back and forth coming into this. And Republicans had some different ideas as to what should be done, what shouldn't be done, when it should be done. And so, coming up as the days are getting closer and closer to March 23rd, President Donald Trump essentially issued an ultimatum to the Republicans and said, hey, we promised as part of our campaign that we would repeal and replace the Affordable Care Act as quickly as we were able. So President Trump essentially issued an ultimatum to the Republicans and said, vote on this bill, pass this bill. The president did endorse this bill at the time. And he said, then let's move on. Let's move on to our other agenda items. Let's move on to tax reform. Let's move on to immigration. Let's move on to infrastructure. All these other things that Republicans want to do. But if you can't get health care reform done and you can't get repeal and replace done today, move on. That was his ultimatum. And so this bill was being considered in the House. And on March 23rd, Speaker of the House, Paul Ryan, contacted the White House and said, hey, Mr. Trump, we don't have enough votes. It doesn't appear we have the 218 House votes that we need. So we're going to need a little more time. So they decided to push the vote to the following day, to March 24th. And March 24th came around, and Speaker Ryan contacts Trump again and just says, hey, it was probably 2, 3 o'clock in the afternoon. Said, hey, Mr. Trump, I don't think we have the 218. So if we put this to a vote, it's going to fail. And so ultimately, Trump advised Speaker Ryan, pull the bill. So the bill, this American Health Care Act, that Republicans had thought would, or many Republicans thought would be the primary mechanism for repeal and replace, never even got to a vote. So it got pulled. So what really is the issue? What's the stall? What's the drawback that's hanging up Republicans with the repeal and replace initiative. And, there's really, I'll say, three different battles that Republicans are facing. And the most obvious one is Republicans versus Democrats. It seems no matter what the issue is, healthcare or something else, our Republican politicians and political leaders just strongly disagree on everything. And this goes back to the Obama administration and even the administrations prior to that, but it seems to have escalated more so than ever today under the Trump administration. So we know that, at least for the foreseeable future, it does not appear Republicans and Democrats are going to work together on a health care bill. So that means Republicans are going to have to use the budget reconciliation process as a primary part of their efforts to oust the Affordable Care Act. Then we have the general public, which obviously politicians represent their residents, and they represent the public within their state. And ironically, while President Obama was our acting president, the Affordable Care Act never really got significant favorable ratings. It was always less than 50%, or it seemed like most of the time various polls would show less than 50% of the public supports the Affordable Care Act and supports Obamacare. They think it needs to be replaced or repaired or fixed. And ironically, now that Obama is not our president and President Trump is, the Affordable Care Act polls are showing that it is at its highest favorable ratings. Now these polls are showing more than 50% of the country supports most of the Affordable Care Act. While they recognize there may be some problems with it, they'd rather see a fixing of the Affordable Care Act as opposed to a repeal of it. But I think the biggest issue that they have right now, yes, issues with Democrats and yes, issues with the general public are important, but I think the biggest issue that they have today is with their own party, within their own party. If you're following it at all, there is some significant internal party conflict as it relates to repeal and replace. So we have, there's different types of Republicans, and generally we categorize them into two different buckets: conservatives and moderates. And conservatives are, on the far right side of the spectrum. And what I mean by that is they generally support as little federal government involvement, in many that are important issues. And when they took a look at that American Health Care Act, many of these conservative Republicans said, you know what, this American Health Care Act does not repeal enough. We need to add more things into this bill and get rid of those. And they also said the American Health Care Act didn't repeal provisions fast enough. Many of the provisions were phased in, some not taking effect until 2020. And they said we can't go back to our state residents and tell them that in 2018 and 2019 we're going to still be dealing with high premiums and a high out-of-pocket. They want things to move faster. And then you have moderate Republicans, which take a little bit of a different approach. They're not as far right on the spectrum, and they really were concerned with people who gained coverage under the Affordable Care Act that wouldn't have otherwise. Primarily those people that newly qualified for Medicaid, and they wanted to make sure that, hey, we recognize from the moderate perspective, they recognize that they want repeal, they want replace, they want change, but they don't want to just sweep the rug out from people and cause them to lose coverage if they've since qualified for it as a part of the Affordable Care Act. So you kind of have this back and forth between moderates and conservatives that the Speaker of the House and the Senate Majority Leader are trying to work with, and it just doesn't seem to they can never seem to get on the same page. When they work with conservatives to add things that conservative Republicans want, they seem to lose some votes from moderate Republicans, and vice versa. When they're working with the moderate Republicans and doing some things that they'd like, then they seem to lose some votes from conservatives. So, this is the major stall right now. We know that, or at least we believe probably about 70 to 80% of the bill, the American Health Care Act bill, was supported by both conservatives and moderates, but it's what's not included that conservatives are concerned with, or how fast things get done they're concerned with. And then, of course, the moderates have concerns about people losing coverage who gained it through the Affordable Care Act. So there's a lot of internal party conflict right now. So as we stand today, I like to say repeal efforts they're on hold. They're on what I call spring break. Last week, Republicans, they met, they held closed-door meetings. They didn't want, the conversations of these meetings to get leaked to the public. So they had several meetings, both with moderates and conservatives, together in the same room. The goal, of course, is to get a bill that can pass, that is agreeable by all or most Republicans. And they were not able to get a bill on the table. Leaders from both moderates and conservatives said progress was made and they are making strides forward, but there was no bill that was actually agreed on, voted on, or passed. So just some conversations, more or less. So here we are today. Congress is now on their spring recess, or at least the House is on their spring recess. House Republicans have all, and House members in general, have all gone back to campaign in their home states for the next 2 weeks, and they'll be there until April 24th. So since they're not in D.C., it's not expected that they're going to have many deep dive discussions as to how to craft or change the American Health Care Act, or what steps they need to do to go forward. So they're likely going to hear from their state residents. And those residents, I know I've seen some town hall meetings already with some residents concerned about what's going to happen with their insurance. And so that may impact how some of these House members respond when they return from their recess later this month. And then when they do return later this month, they do have some federal budget bills that need to be immediately addressed by April 28th. So I don't know that health care becomes an immediate revisit that first week they come back, and that means we're likely going to carry repeal and replacement discussions into the month of May, if not longer. So some next steps for Republicans in their repeal and replace agenda is what to do, and I've lumped them into 5 buckets. There may be a 6th or a 7th bucket that comes up or is not discussed today, but this is really, they have 5 things. And when we talk about repealing and replacing the Affordable Care Act, it doesn't necessarily have to be done with a single bill, although that seems to be the way that they could accomplish the most. There are other things that they could do, but the first thing that they'll probably do, or shortly after they come back from their spring recess, is resume efforts to pass a repeal bill. Some other things that they could do if they continue to stall with a repeal bill, they also can look at tax reform. That's another big agenda item for this Congress, this Republican Congress at least, is to look at the tax code and how can it be simplified or changed for not only individuals but also businesses. And are there some things they can change or repeal through tax reform that also impact healthcare reform? So that's something they can take into consideration. There's also agency regulatory guidance that could be issued. So these are those agencies that really police and administer the Affordable Care Act. There's some things that could be eased or changed from a regulatory front that could impact the ACA, although probably nowhere near as significant as passing actual legislation. They could also try to go about this drafting separate standalone bills that kind of tackle the ACA one item at a time, as opposed to trying to get several items into one massive bill. And the last thing they can do is nothing. And I want to just dwell on each of these just a tad bit further to understand sort of the pluses and minuses, or the challenges that come with each of these initiatives. And the first is getting back to what I'll call the drawing board, resuming efforts to to get a bill in place that really gets rid of a lot of the Affordable Care Act, replaces it with something different. And there is fully a belief that these talks are going to resume and they are going to continue, but timing is now becoming more and more of an issue. I think a lot of people thought this would already be done by now and we'd be on to the next thing, but timing is now becoming a big issue because of this internal party conflict that they have. And a big date or a milestone date that's coming up is June 21st, so just about a little more than 2 months out. This is the deadline that insurance companies have to submit premium rates and plan design information if they want to sell health insurance plans on the exchange. And this is already a 7-week extension. So originally, insurance companies had May 3rd was the deadline. Well, now it's June 21st. So that's fast approaching. And we know there's been less and less participation in the exchanges over the first few years of their existence. You know, again, going back to only 1 in 3 counties in the United States have an insurance company offering coverage on the exchange. With uncertainty or without any change, those numbers could shrink even further. So there's a concern that something needs to be done quickly in order to give insurance companies at least an idea of what the laws and regulations are going to be in 2018 and beyond. So we'll have to watch what happens there. And let's say nothing does happen in 2017, which is a possibility. They could continue to struggle with this. You know, next year is a midterm election year. You know, every House seat is up for vote in 2018. About a third of the Senate seats are also up for vote. And healthcare is a very important issue to many people. And voting on something that is potentially a very controversial bill, you know, might impact your ability to get reelected, or might impact the Republicans' ability to remain as the majority in the House or the Senate. So oftentimes in midterm election years, significant guidance or significant legislation doesn't get passed. So, you know, we'll have to see what's going to happen over these next couple of weeks and couple of months. You know, tax reform, I did mention, is another approach they could take. I did mention at the start of the presentation, there's about 20 different direct and indirect tax provisions that are a part of the Affordable Care Act. Just an example of some of those. Health insurance companies are taxed about 2.3% of premiums as a part of the Affordable Care Act, and that tax, again, is used to help fund some of the subsidies that are provided through the exchanges to individuals, as well as some of the additional people that gained access to Medicaid. Likewise, there's a tax on people that make medical devices. If you're a medical device maker, you're also paying a couple percentage points in taxes, again, as one of those pay-fors to help coverage expansion efforts. I mentioned previously pharmaceutical manufacturers have approximately a $15 billion a year tax. There's also a tax on high-income earners. You have an extra 0.9% Medicare tax for earnings in excess of $250,000. And so through tax reform, the Republicans can get rid of many of these taxes or change them or reduce them if they so choose, but it would just be going after the taxes. So that is one thing. You can start somewhere with tax reform and almost sort of swoop in some of these healthcare reform taxes and make alterations there. Then we have our chief regulatory agencies as it relates to healthcare and health insurance, and that would be the Department of Health and Human Services, the Department of Labor, and the Department of Treasury. Collectively, these three agencies are referred to as the tri-agencies. And the tri-agencies cannot pass laws. In order to pass a law, that has to be done, through the House and the Senate and signed into law by the President. But they do regulate and enforce laws. I like to use the analogy Sometimes you get pulled over for speeding by a police officer, and if you're lucky, they'll give you a warning. If you're not so lucky, then they're going to write you a ticket. It's just how they choose to regulate that particular situation. And the tri-agencies can do some things from a regulatory standpoint, and they have done some things from a regulatory standpoint already under the Trump administration. So one of the first things that has been done, there is this, it's formally referred to as the individual shared responsibility, but informally referred to as the individual mandate. Again, this is the requirement that if you need to have health insurance or you're subject to a penalty unless you qualify for an exemption. And through the Department of Treasury, through one of their sub-agencies, the IRS, probably the most familiar sub-agency of the Treasury Department, the IRS announced, I believe it was in the beginning of February, that they would now process federal income tax returns even if somebody failed to indicate whether or not they had health insurance or whether or not they qualified for an exemption. And this is something completely different than was being done under the Obama administration. Under the Obama administration, if you filed your tax return with the federal government, your federal tax return is the means by which you pay a penalty if you're subject to a penalty. But under the Obama administration, if you filed your tax return and you didn't include any information about whether or not you had health insurance, the IRS would kick back your tax return. They would reject it. Well, now they're saying we're not going to reject it. The individual mandate is still the law of the land, and if you fail to put information on your tax return, you could get audited at some point in time. They may ask you to pay a penalty, but they're not going to reject your tax return if you fail to disclose your insurance status. So that's a little bit of an easing of the enforcement of the individual mandate. Some other guidance came from the Department of Health and Human Services, HHS, and this was really guidance specific to the individual market and specific to exchanges. The Trump administration and many political leaders have had several meetings with large insurance companies, their CEOs and their CFOs, and many of the key stakeholders within these insurance companies. And they're really trying to get some feedback from them. What can we do to make sure you stay in the individual market? And some of that was relayed in the form of regulatory guidance from HHS. And what was proposed, it hasn't been finalized yet, but they proposed some rules in February, opened them up for public comment through March 7th, and expected to see finalized a ruling sometime within the next couple of weeks. But some of the things that this regulatory guidance does is it shortens the open enrollment period for 2018. Now the proposed open enrollment period is now going to run November 1st through December 15th, as opposed to November 1st through January 31st of the following year. So cutting that enrollment period in half. Additionally, the exchange is going to do more verification to determine if somebody has a qualifying event outside of the open enrollment period and they are actually eligible to sign up for coverage. In the early days of the exchanges, it was almost a check-a-box or an honor system where you just had to contact the exchange either online or over the phone and let them know what qualifying events you had, and they wouldn't ask you for any documentation, or it would be rare that they would ask you for any proof. And now they're going to move to the fact that you have to provide documentation for every qualifying event. So if you lost coverage or you got married or you had a child, you're going to have to provide some sort of document that supports that you had that qualifying event. There's also been some people that have been taking advantage of what's called the grace period. This is when you have some, there's always due dates for when your insurance premiums must be submitted to the insurance companies. Well, they have, if you buy a plan on the exchange, you actually have up to 90 days after the due date to make your payment. And what some people were doing is they were essentially taking out their insurance coverage, and then towards the end of the year, they would stop making their premium payments. And they would only make that premium payment if they needed to use their coverage. And if they didn't need to use their coverage, well, then they just would avoid paying their premium for the last couple of months of the year. And that was obviously a little bit controversial to the insurance companies. So they've issued some new rules that will allow the insurance company to essentially collect those payments in the event an individual does that and then reapplies for coverage the next year or at some point in time in the future. They have to pay back those past premiums owed before they can get new coverage. And another thing they're anticipating doing is allowing more plan design to be to meet what we call the metallic tier status. So more plan designs can be considered a bronze plan or a silver plan or a gold plan or a platinum plan. There's some very tight rules as to how to fall into one of those buckets, and all plans in the individual and small group market must fall into one of those metallic tiers, and now they're going to ease that requirement a bit. So separate legislation was another thing I mentioned they could do. There was actually a bill that was introduced called the Health Savings Act of 2017. This is just one example of something they can do. It was introduced by Marco Rubio and Orrin Hatch in the Senate, and companion legislation was introduced by Eric Paulson in the House. Essentially, the same bill was introduced in the House. And, this is something that doesn't, repeal or replace the Affordable Care Act, but it does expand upon Republican healthcare objectives of making HSAs a more prevalent product for paying for healthcare services. And this is something that could get passed if politicians choose to move forward with it, but it would increase contribution limits, make more plans and more people eligible to establish an HSA, increase the types of expenses that could be paid for on a tax-free basis out of the account, allowing some carryover of unused funds from a flexible spending account or a health reimbursement arrangement to an HSA. And it would eliminate some certain glitches. For example, if you're age 55 or older, you can contribute an extra $1,000 to your HSA. But if you're married, it requires 2 separate HSAs for both spouses to be able to make the separate $1,000 HSA contribution. This Health Savings Act of 2017 would allow both spouses to contribute $1,000 extra if they're age 55 or older to the same HSA. So this is something that could get passed without, a more controversial repeal or replace bill. And one of the last things they can do is nothing, as I mentioned. Right after the failure of the American Health Care Act, when they pulled it from the House and they didn't vote on it, President Trump was quoted as saying, "The best thing we can do, politically speaking, is let Obamacare explode." So there is a general belief by President Trump and many Republican politicians that insurance markets are going to collapse if nothing is done. And if they're right on that, that should ignite more repeal and replace efforts, not just amongst the Republican Party themselves, but if we get to crisis mode, some believe we're already at crisis mode, and others think we're not there yet, or maybe we're not ever going to get there. But if we do get to this so-called crisis mode, then it could bring Democrats across the aisle where they would have to work on a bill with Republicans that would start to make changes. Maybe it's not a complete repeal, maybe it's more of a repair, but things would be different if we do get to a much more urgent situation. So the future of repeal is the best thing I can tell you at this stage is it really seems like uncertainty is the only thing that is certain, especially now that House members are on their spring recess and they're going to hear from their state constituents and they're going to come back and they're going to have to regroup and figure out where do they go from here. And so what exactly changes? We know at a high level what their objectives are, but how does that sort of trickle down to more of a tactical level? We don't know yet. A bill hasn't been passed. We've only seen proposed legislation that hasn't been able to get passed. So what changes? I don't know is the best answer I can tell you at this time. The timing of when things change, I don't know. The American Health Care Act was going to repeal some things retroactive. It was going to repeal some things next year. It was going to phase some things out and change them a few years out. We won't know until we actually have some legislation or some regulatory changes that occur and give us more definitive timing. You know, the methods of repeal are also unclear. I wholeheartedly believe they are going to try to pass a bill through the legislative process that makes significant alterations and repeals significant provisions. But if they're not successful there, they do have some of those other methods. Again, one of those methods being do nothing. Others are trying to tackle, you know, smaller provisions one at a time, maybe seeking HHS or Treasury guidance. We just don't know. And, you know, when we talk about repeal, usually if we're going to take something away, we've got to figure out, or they've got to figure out, well, what are you going to replace it with? So what those replacement provisions will be, again, won't be known until we get a little bit further down the road. So the future of the ACA, the Affordable Care Act, or Obamacare, right now, at least in the foreseeable future, the short term, is it continues to be the law of the land. It has not changed. The individual and employer mandates still are what they are. They're still enforced. They still are the law of the land. If you're buying coverage on your own or you're accessing coverage or offering it as a small employer, you know, your bronze, silver, gold, and platinum plans are still your option. The exchanges continue to operate, and they continue to provide subsidies to eligible individuals. So, you know, as we know it, the rules are still those rules. So the last couple of things I want to comment on, and if you do have any questions, you're more than welcome to try to type those in, and we'll address as many as we can here. But I want to talk about the individual market and then the group market, and then open it up for any final comments and questions. But the individual market is experiencing a great deal of volatility, and the individual market being those of you that have to buy coverage on your own. Either it's a choice of yours or maybe that is the only option of yours, but you have to buy it on your own. You don't have coverage through an employer. You don't have access to Medicare or Medicaid or some other government type of insurance. You're getting this on your own, whether it be through an exchange or not. It's going through a great deal of volatility. Choices are going down and premiums are going up. So those are the two. We'd like to see those things the opposite, choices going up and premiums going down, but in reality it's been the opposite of that. And absent any government intervention, there's a good possibility that some counties or even entire states are not going to have any individual health insurance options next year or maybe the following year. Now, some will say because of government intervention, that is the reason why some counties don't have many options today or may not have any options in the future. But the individual market seems to be, you know, the main thing that the Republican politicians are looking at, trying to find some sort of solution to. And what that solution becomes, if anything, possibly nothing, I don't know. Really, it puts this marketplace in a state of volatility right now. And again, as I mentioned, we only have a couple months out before insurance companies are really needing to file their rates and decide if they're going to participate in this market going forward. So it's a little bit of a scary situation in this particular market right now. If I were a betting man, I would think we're going to be okay in Illinois, but in other states, Arizona, Colorado, Ohio, Kentucky, Tennessee, there's some states there where there's a good chance, right? I mean, absent change, that there's going to be pockets, if not entire states, that don't have any options. Now, on the other side, the employer market is a more stable market, and if you're an employer or you're accessing coverage through an employer, maybe you don't feel that way, but in comparison to the individual market, it is more stable. There are more plan options. There's more insurance companies offering plans. within these market segments. In the individual market, there's a lot of small network plans and HMOs that are the primary options available. In the employer market, you have those smaller network options, but you also still have today larger PPO network options. While premiums are going up still, trending upward in the employer market, they're not trending upward by nearly as much as they are in the individual market. For those of you that are a business owner or work for a smaller business, you may be able to even have a group health plan that covers just one employee. And I know our folks at within IX Solutions can help answer whether or not that's an option for you. There's also something, this was a law that was one of the last significant laws that was passed by Obama at the end of 2016. This was part of what's called the 21st Century Cures Act. There's something called qualified small employer health reimbursement arrangements that are now an option as of January 1st, 2017. Essentially, if you work for an employer that has less than 50 employees, you now set up a reimbursement account for your employees to go out and use funds to buy an individual plan on their own. So that's something we can also talk to you about if you had questions on that. But Grace, I'm going to turn it back to you for any final comments, and if there is a question or two, we can take that at this time.
Okay. Thank you, David. And I just want to note that these slides will be sent to everyone a few hours after the presentation, so you will be getting a copy of these. And let's just wait for some questions to come through. At this time, feel free to type any questions you might have in the chat box, and I'm sure David will be happy to answer those.
Yeah, and I'll just add, this is a really, I think I've emphasized it enough, it's a very fluid situation. It seems like 1 week they're very close to getting something passed that will repeal and replace, and then the next week it seems like there's some sort of hurdle where they take a big step backwards. So, it's just one of those things where we really are just in a wait and see type of mode.
Okay, this is Malik from IX Solutions, the Product Development Manager. There is one question, and the question is, please discuss the one-person employer plan option. And that's a great question because we've received many of those questions previous open enrollment, and we feel like that's going to continue happening because, of course, the large networks and the hospitals that many people are looking for just aren't available in the individual market. And the best way to do that is through an employer plan. Now, the only way to get that through an employer plan is you do have to have at least one additional employee. So yes, the question says one-person employer plan. That's only possible if you have an additional employee that's on your wage and taxes. It cannot be a 1099. It has to be a W-2 employee. But of course, what you can also do if you have specific questions on how to get that set up for your next open enrollment, or even now, again, group plan can be set up at any time, call us and we will direct you on how to get this going forward. Pause it, and we have a few more questions. So there's another good question that came through. I'm going to read this. How do you advise people who have no health coverage? I mediate divorcing couples, and many have no coverage once they cannot be on spouse's insurance. So that would technically qualify as a qualified life event. Anytime they lose coverage, if they previously had coverage and then they lost it due to changing circumstances such as divorces or moving out of a network, right? So if you move from New York to Chicago, these are all, there's a few other qualifying life events that would qualify somebody. Once that happens, we advise give us a call, or you can even visit the Chicago Bar Association page, and there's the ability to shop for individual health plans. Now, of course, if you're not on the employer plan, your network selection and plan selections will be limited to individual marketplace. And at this moment, Blue Cross would be the ones that we would be assisting you with. Continue asking questions. We're going to pause for just a few more minutes.
Okay, another question. Should people stop paying the individual mandate insurance tax of the ACA as it won't be enforced? David, I'm going to let you take that question.
Sure. So the individual mandate is still the law of the land. It has not changed, nor has it been eliminated. It's just a matter of whether or not the IRS is going to accept or reject the tax return that you file. And they've indicated if you omit information, they're going to still accept that. Now, I will tell you, if you knowingly and willingly omit information from a tax return that is pertinent information, that is potentially a crime, that is tax fraud. And I will also say that just because they might accept your tax return doesn't mean they might not come back to you and audit you at a later point, whether it's not this year or next year or the year to follow. So I think, from a compliance perspective, the best thing to do if you do owe a penalty is to own up to it, admit it on your tax return, and pay it. That's your safest bet. But if you are a bit of a risk taker, that is your prerogative as to how you want to proceed there. It's not something I would advise or recommend to anybody, but it is something based on this IRS announcement that I would assume some people are probably going to try to take the gamble on and do. I don't know how long the IRS will take this position. They took this position in response to an executive order that was issued by Donald Trump on January 20th, the day he was inaugurated as president. But I also think that IRS comment on this also came with a belief that the individual mandate was going to be repealed, and that American Health Care Act had proposed to repeal the individual mandate retroactive to January 1st, 2016. And as you know, we're in a stalled point here. So it is still in force. It's really each person should probably seek their own professional advice from a formal tax preparer. But that's the best advice I could give at this point in time.
Okay, we'll give one more second if any more questions come in. Okay, everyone, this will conclude our webinar. If you have any other questions, feel free to contact us at the provided email address, as well as reach out and give us a call. We're always happy to help with Chicago Bar Association's existing benefits and help set up new, group or individual. Thank you. That will conclude our webinar for today. Thank you for attending, everyone.
Thank you, everyone.